Jawbone density and bone density is definitely something that women should be aware of. As we lose density in all our bones, we see the same happens in the jaw. We have increased breakdown of bone, and as we said previously, we don't have as many building blocks to regenerate the bone.
Yeah.
So the bone tends to break down a bit quicker and we tend to lose density.
Hi there, I'm Shanine. As a certified health coach and kinesiologist, I help busy women in their 40s who feel tired, overwhelmed, anxious, frustrated and stuck to live their best years in great health and balance. Together, we'll explore a life that reflects intentional living and lays the foundation for you to live your life's purpose and flourish in your 40s. Welcome to Becoming You at 40. Today we are talking about something that almost no one prepared us for. How perimenopause and menopause can completely change your mouth. I know it sounds strange, but only until it happens to you. Maybe your mouth suddenly feels like sandpaper. Maybe your gums feel more sensitive. Maybe your teeth feel different and you can't quite explain it. Or maybe your dentist says something like, "Are you under more stress?" And you just want to scream, "No, it's the hormones." So today I brought on an expert who gets this. Someone who works directly with women and understands exactly what estrogen, sleep, stress, medication and all of midlife's chaos can do to oral health. Dr. Jacobi Klaasen, very welcome to the show. I look so much forward to this very interesting conversation.
Thank you, Shanine. It's lovely to be here, and thank you for inviting me to talk about this very important topic today.
I can't wait. I think we've known each other now for about 3 or 4 years.
I think so,
Yeah,
give or take.
Give or take. It's been a while, and I've always been so impressed by your professionalism and your attention to detail and the caring manner in which you conduct your consultations. So when I thought of this topic, I thought you were going to be the perfect person to talk to. So I'm very, very appreciative of you being here today.
Thank you so much. It's lovely to hear that, and it's always wonderful to get some positive feedback on what we do.
Of course, yes.
Thank you.
Now, just before we start, I would like to invite the listeners to follow this podcast. If you are a woman in your 40s who's ready to feel more confident, energized and intentional every single day, then this is your space. So please hit follow so you never miss an episode that helps you create the life you deserve. So, Jacobi, first things first. Most of us are so focused on hot flushes and the weight gain and the mood swings that anything around your mouth, it doesn't even feature on the menopause or the midlife list. So why, in your opinion, should women in perimenopause and menopause pay more attention to their oral health?
I think the main message is definitely the message that you are giving to women out there. The fact that perimenopause is real. The more research that is being done, the more light is being shone on this transitional period from when our menopause symptoms start to when it's actually completed. And there are so many changes that take place during this period. The changes does not only affect our health, but it also affects our well-being and our mental health and our happiness. And that is why it's important for women to be aware of what can happen, what are the things to be expected, the changes to be expected in their mouths. And when they do notice them, that they can get help to address these changes effectively and in a timely manner, that they don't get any worse.
Absolutely, yeah, that makes so sense. I just want to circle back to hormones for a moment, because we know that hormones rule the show, and it affects absolutely everything. And sometimes even things that we didn't even know that we were supposed to worry about. So how does changes in our estrogen affect our dental health and our oral health?
So before we can look at what the effects of the changes are, I feel it's important to know what is estrogen's role in keeping our mouth healthy. That way it's easy to know what happens when it actually changes. So estrogen, as you say, hormones rule the show. That is true. Estrogen, the role of estrogen is like the role of your best friend when you're at a party and you've overindulged a little bit.
Okay.
So she keeps you upright, she keeps you protected, and she keeps you hydrated.
Okay, so she's very, very important.
She is of crucial importance.
Yeah.
And the same with estrogen. Estrogen is involved with structural integrity of tissues, meaning keeping us upright.
Okay.
It's involved a lot with the production of saliva, which has a largely protective function in our mouths, and it keeps us hydrated, and that hydration is important. The lubrication of our mouths is very important for basic functioning, like eating, chewing, and swallowing. So estrogen, as you said, of crucial importance. When we look at structural integrity, estrogen is very closely related to the production of collagen. And collagen, we all know about collagen in our skin, with importance of collagen for skin health and prevention of wrinkles. But collagen is building blocks for tissue.
Okay.
And tissue in our mouths, like gums and bones and even cartilage in our joints, all make use of collagen to be regenerated. So when we start losing estrogen, we lose collagen.
Sure.
And we don't have the means or the resource in it anymore to regenerate these tissues. So it leads to quicker breakdown of gum tissues. We're more prone to gum diseases, breakdown of bone, we lose attachment around our teeth, and even cartilage in the temporomandibular joint, which we'll touch on a bit later. With saliva, estrogen makes sure we have enough saliva, and the importance of the antimicrobial function of our saliva to keep our mouths healthy.
It's not something that should be taken lightly.
No,
the role of
definitely
estrogen.
not.
I mean, I didn't know that estrogen plays such an important role in our mouths. So thank you very much for sharing that with us. I'm sure that you get women in your chair that have very specific complaints. And I think one of the most common complaints, according to what I've heard, is dry mouth. Women would wake up in the morning with their tongue stuck to the head of or the roof of their mouth, or it would feel as if they just can't get enough water. So what makes the mouth so dry, and is it something that must be taken seriously?
So saliva is one of the most important things in our mouths. It is a lubricant, as we said, for basic functioning, like chewing and swallowing and even speaking. And saliva is protective. It protects our gums, it protects our teeth. The antimicrobial aspect of saliva makes sure that we are protected against pathogens and decay. When the mouth is very dry, so when we lose estrogen, we have less saliva production and the quality of our saliva decreases. We don't have enough of those antimicrobial properties in our saliva. So the saliva that is produced can often be of poorer quality. And then when the mouth is very dry, this can upset the important or the sensitive balance of microbes in our mouth. As we have in the gut, we've got a very sensitive balance of microbes that live within the oral cavity.
Okay.
And when that balance becomes upset, we have overgrowth of fungal microbes, which is what we don't want.
Absolutely,
That's also
yeah.
why many women who struggle with dry mouth experience thrush or candida overgrowth. And yes, it must be taken seriously, because these infections that we get, candidal infections, can lead to other problems, pain and burning mouth syndrome, which we're going to touch upon. But also a dry mouth can exacerbate any other conditions that one already has in our mouths. Something like a slight gum irritation can become a full-blown gum infection, or tooth decay can suddenly become rampant. You may have never had a filling previously in your life, and suddenly you get to perimenopause and you need fillings, and one doesn't know why. So saliva is of a crucial importance.
So what I'm hearing from you is that a dry mouth can actually set off a chain reaction.
Yes.
And I think you've alluded to that already, but it's basically been true that women in perimenopause and menopause are more prone to cavities. Am I right?
We are, unfortunately, women are. And especially due to that quick decline of estrogen, all these changes can happen abruptly. And estrogen can fluctuate immensely during this time. So often these changes are not consistent. The salivary flow can change, and one can get used to the feeling of dry mouth. That's why it's important to be aware.
Oh yeah, of course. Yeah, you can think it's normal.
You can think it's normal. The problem
Yeah.
is, especially if this happens over a period of 5 years, you may not even notice it. And you
yeah.
can sit with the complications of the problem without even noticing the problem in the first place.
Yeah, that's quite crucial to know. So people must actually be aware of that and communicate that as soon as they realize that they feel those changes in their mouths. And you've mentioned burning mouth syndrome.
Yes.
I have a friend actually that suffers from burning mouth syndrome. And I mean, just hearing the phrase is quite terrifying.
It is. It is.
And I must admit that she really, for her, it is a terrifying experience. It's really life altering, and I don't quite understand what causes burning mouth syndrome. And do you know if there is anything that women can do to alleviate those burning, that very uncomfortable symptom that they feel?
So, burning mouth syndrome, I agree with you. It sounds terrifying. And I hope I don't want all the perimenopausal women listening to this podcast lie awake at night worrying about this. But burning mouth syndrome it's a chronic condition that is characterized by pain, unlocalized pain. It can be on the lips, it can be outside of the mouth, it can be on the gums, it can even be on the tongue. So it's a painful sensation, and often it's chronic and it's ongoing.
Sure.
And that is what makes it so taxing.
Yeah.
It is often seen in women during this perimenopause, menopausal stage. And unfortunately, research doesn't fully understand quite how this works yet. We do not have a single factor or a single cause for burning mouth syndrome, which makes it difficult to treat and difficult to diagnose. It's often multifactorial with many contributing factors.
Okay.
And all of these factors are the things that we see during this perimenopausal stage. Hormone imbalances, dry mouth or decrease in saliva, fungal infections. We see often nutritional deficiencies, specifically vitamin B12 deficiency, stress, anxiety, depression. So even mental well-being can contribute to one's experience of burning mouth syndrome. The treatment because this is such a complex condition, the treatment of burning mouth syndrome, you need to cover all of these factors to try and get some relief. And often, to get relief of burning mouth syndrome, we cannot clear the pain up completely. For some patients, relief is just bringing the pain down from a 9 out of 10
Sure.
to a 2 out of 10, or decreasing the duration of pain. When we talk about treatment for burning mouth syndrome, it's usually a whole array of things that we look at. We need to treat the dry mouth. We need to get saliva production up.
That makes sense, yeah.
That can be done in a few ways. There are fantastic products on the market that are commercially available, even in your local Dis-Chem.
Okay.
But I always advise patients or women that suspect that they're struggling with dry mouth or burning mouth syndrome to seek help from their dentist, because they will advise which products are most suitable for them. We have lovely toothpastes, sprays that can be sprayed into the mouth, gels that can be applied inside the mouth, that does not only lubricate the mouth, but that helps with saliva production in the long run. We often give patients with burning mouth syndrome a course of antifungal treatment to make sure that we don't have candida or overgrowth. We look at a vitamin B12 supplement, advise them on their diet to make sure that they're getting enough fresh produce, lots of fruits and veggies, to make sure that there's no nutritional deficiencies that can be responsible. We advise them to try and manage stress. I know that is not easy in our modern day-to-day life, but to look at the stressors in their everyday life.
It's not just, sorry to interrupt you
No,
there, but
not
it's
at
not
all.
just about stress in the modern day life. I think going through perimenopause and menopause is stressful enough anyway.
It's stressful in itself.
Yeah.
It's stressful in itself. And I think often if you have burning mouth syndrome and you go to a practitioner who is not fully aware of it, the anxiety or the frustration of dealing with someone who doesn't make your feelings feel validated.
Yes, I think that's important, yeah.
Because burning mouth syndrome hasn't been around for that long. Previously, there was no diagnosis for it. It was defined as atypical facial pain. But now we know the basis of where this condition is coming from, and at least now we can cover these problems to make sure we try and get some form of relief for the patient.
I think that's maybe, you've just alluded to that, but I think that's one of the pain points, you know, despite the physical pain. I think the personal journey that you go through that nobody else understands. I think it can be very isolated, because you sit with this fear or this pain. You can't necessarily eat what you used to eat, or you don't feel like eating, so you feel unsocial, and you don't always want to complain about the pain, but as you said, it's chronic. So I think there's more than just the physical pain that's involved there that makes that really a horrific symptom that women experience.
Definitely.
Just a question, you say it's chronic. Is it something that will pass over at time?
It can. Interesting, depending on the patient, one of these treatment modalities often brings them quite a bit of relief. In some patients, it's the treatment of a fungal treatment that will bring them immense relief. But we can get relapse. It is something that can recur.
Okay.
So often it also clears up once this transition of menopause stabilizes, once we get stabilization of hormones. But it's difficult to say. I'm sure in some patients it is an ongoing struggle that continues lifelong.
Sure.
We just need to try and keep it manageable for patients.
Sure. Well, thank you very much for that. That was really very informative, and it's good to know that there is something that women can do, and that they don't have to sit with that pain, that there is some solution. So hopefully they will ask the questions when they do visit their dentist. You mentioned earlier something about bone health, and you know, usually when people talk about menopause, bone health usually comes up because it's such an important part of this transition phase. But I don't think everybody always realizes that the jawbone is part of that conversation. So is jawbone density something that women should be worried about or be aware of?
So Jawbone density and bone density is definitely something that women should be aware of. I think if you are a healthy woman going through perimenopause and you've never experienced complications with bone health, it is not something that you need to lie awake at night about.
Okay.
But it is important to be aware. As we lose density in all our bones, we see the same happens in the jaw. We have increased breakdown of bone, and as we said previously, we don't have as many building blocks to regenerate the bone.
Yeah.
So the bone tends to break down a bit quicker, and we tend to lose density. Important, this is very applicable to patients with predisposing conditions. So in a patient who already has bone loss around certain teeth, someone with periodontal disease, perimenopause will worsen that condition.
Okay.
But in a woman who has a healthy mouth, this is something just to be aware of. It's not a risk factor for disease if there isn't any disease present at the moment. But important, if you've lost a tooth and if the tooth needs to be replaced with something like a dental implant, that can play a role, because for a dental implant we need sufficient bone density to place the screw within the bone. So if you do not have enough bone density, you're not a good candidate for dental implants. So it has certain implications. The most important thing is just we need to try and keep our mouths healthy. We need to keep our bones healthy so that whatever is there before perimenopause does not get worse quick during that transitional stage.
Yes, now that makes very good sense. And I know strength exercises helps for bone density, so that will help for your bones right from head to toe.
Yes, nutritional supplementation, strength training, that will increase bone density. And unfortunately, we don't have any strength training yet for our jaws.
Specifically for jaws.
Well, yeah, some patients grind at nighttime, which I guess it constitutes strength training for jaws, but nothing on the radar yet.
Now, a lot of women that are going through midlife are on various medications, and that's obviously due to the symptoms that they are experiencing. So I see a lot of women on antidepressants, anti-anxiety medication, or hormone replacement therapy or sleeping pills. How does medication impact our oral health during this phase of transition?
So, unfortunately, many of the medications that are used to treat the systemic symptoms of perimenopause tend to actually exacerbate the symptoms of perimenopause in the mouth. So in short, those lovely hormone replacement therapy medications that help with the hot flushes and make one feel better can actually worsen your dry mouth.
Okay, that's not that much good news.
No. So, but it's still worthwhile taking them.
Yes.
It's still worthwhile taking them. Not only hormone replacement therapy, but as you mentioned, many antidepressants, anti-anxiety, even some sleeping tablets can all cause dry mouth. Even other medications like hypertensive medications, medications for high blood pressure can reduce saliva production. So all of this unfortunately causes a snowball of all these effects and all these symptoms. And some of these medications, not the sleeping tablets, well, the sleeping tablets as well, they disrupt the way that we sleep. It disrupts sleeping patterns. With disruption of sleeping patterns, we can get often increased tooth grinding or bruxism at nighttime. And this, together with the decrease in estrogen, which actually hydrates the cartilage in our joints, can lead to joint pain due to grinding at nighttime. Many women find that they wake up in the morning with headaches and neck pain and muscle spasms around the jaw. And this is very common during that transitional period, but also even just for women of all ages. Bruxism is more common than people realize.
Sure. Well, thank you very much for that piece of information. I think it's time to get a little bit practical. I always like to leave the listeners with something that they can take with them, and something that they can start doing today. So what advice would you give women regarding daily habits, or maybe some simple nutritional choices that they can do to support their mouth health during perimenopause and menopause?
So you do not need a 10-step oral hygiene routine.
Okay. All right.
It is important to just go back to basics. Oral hygiene habits. 2 minutes twice a day brushing.
Okay.
Flossing once a day. Eating enough fruits and veggies, and a variety of fruits and veggies. Okay. Looking at our sleep hygiene, going to bed at the same time each night, making sure that the room is dark enough, the room is cool enough. Being aware of your body, just being mindful. All of these little day-to-day habits will make us more aware of what is going on, not only in our mouths, but in our bodies.
Yes.
And that can help us to take action when it is necessary.
Yeah, and I think that's the most important thing. People should not sit on what they notice. They must take action. They must ask the questions and know that there are options available to them. And regarding our options, if a young woman that is now in her late 30s, early 40s, so she's only entering this phase, what is it that she can do that is sort of proactive as she enters this phase of transition?
So I think awareness, as we alluded to, being aware of what can be expected, looking out for those symptoms, having knowledge about this transitional phase, having the right resources and the right knowledge, and then also making sure that you have the right people on your team. You need to find a medical practitioner and a dental practitioner that are aware of these conditions and that you can ask the questions to, and who can advise you with the necessary treatment.
Yeah, I think that's very important. That's very good advice. Now, we've mentioned a lot of things up till now. It's a bit of an information overload, and I think some of the listeners might feel a little bit overwhelmed by this stage. So, what is the one thing that you would like the listeners to take with them? What is the one thing that you would like a woman to know about her mouth and her dental health as she enters this midlife phase?
I think the most importantly, two things. The one is, remember that your mouth is a window into your overall health. Pay attention to those small niggles. Take action. Seek help. Second, very, very important message for anyone listening to this podcast who perhaps feels slightly overwhelmed with all of the information that we've talked about. Go and make an appointment with your dental practitioner. I know going to the dentist is probably one of the most terrifying things.
I'm laughing because I share your sentiments.
People avoid us. And I understand. Going to the dentist is scary. I think often dentists are portrayed in that way. Often the most difficult part is to just make the appointment. Find a dentist that you're comfortable with, who's not intimidating, who you can speak to. And if you take one message from this podcast, schedule a dental appointment.
Yeah.
And schedule it with someone who will look out for these symptoms and who can offer you the help that you need.
Thank you very much. I think it's very important advice. And like you mentioned, the mouth is the window into the body, and it really needs the care that it deserves. Dr. Jacobi, thank you very much. You've shared so much information, and you did it in such a beautiful way and such an understandable way. So thank you really from the bottom of my heart for being here today and sharing all of this with us. I really appreciate you taking time to be here.
It's been such a pleasure. Thank you.
If anybody would like to connect with you, where can they get in contact with you?
So I have a dental practice in New Makkelneuk in Pretoria. We are located in Zuid-Afrikaans Day Hospital
Okay.
in Walker Creek Office Park. So they are welcome to contact our practice. Our practice name is Vermilion Dental and Health, which is an interesting name because vermilion is actually the pink part of the lip, and we
Okay.
believe that dentistry doesn't just happen inside the mouth, it is a connection from the mouth to the body, and that's exactly what we alluded to in this conversation. Our website is vermilionhealth.co.za,
Okay.
and you can contact us by email or by WhatsApp, whatever is easier.
Perfect. What I will do is I will link the website in the description box as well for the listeners that would like to get in contact with you.
Perfect, thank you.
Now, to everyone listening, I hope today's episode reminded you that you are not alone and that there is nothing wrong with you. Perimenopause and menopause are natural phases, and with the proper support, understanding, and care, you can move through them with strength and confidence. And remember, as a health coach and kinesiologist, I would love to walk alongside you and your dentist on your journey through this transition. So, working with a health coach can help transform a life of neglect into a life filled with self-care, resilience, and balance. You are welcome to book a complimentary coaching session with me to explore how my services can benefit you. And you'll find the link in the description box or visit www.dayenucare.co.za. Thank you all for joining us today. I'll see you in the next episode where we continue exploring the science, the stories, and the support that help women flourish. Until next time, take care.